first of all, you have to make sure that you have a cancer there. So the diagnosis is really the most important piece of this. Someone comes in with an irregular growth on their testicle. Generally, as a rule, I take a history and physical, and in that physical exam, I examine their testes. I look for any lumps, bumps, anything that doesn't add up as being normal. In addition to that, I'll do an ultrasound to identify whether or not what we're feeling is a pathology. Once we've identified that there's something there, we draw blood levels, because some tumors will actually emit or release hormones that can be measured, or certain enzymes that can be measured, and we draw those tests. We'll send that out, and after we get the results, I go over that with the patient and his family. I will also, at that point, the thing you have to do is you have to remove the testes. So they'll go in and they'll have what we call a radical orchiectomy, or the removal of the testes through a groin incision, not through the scrotum, but through the groin, like a hernia. And then the pathologist has the final word as to what kind of tumor that is. And then once we know what kind of tumor it is, we can either watch them, called surveillance. We can treat them with radiation if the type of tumor they have is sensitive to radiation, and there is one specifically called a seminoma. That is, 40% of the testicle tumors are seminomas, incidentally. And then there's other tumors that actually are from we call them germ cell tumors. They're cells that actively produce, that are involved in the reproductive cycle. They're involved in sperm production. These tumors require, on some occasions, depending on the stage of the tumor, surgery, where we go in and we take the lymph nodes out. And if it's far advanced, they may actually even get chemotherapy before we go in and remove the lymph nodes. So that simple little question you asked had a lot of, you can see how it just branches out and how it's not a real simple problem. It's a problem that once you present, it evokes a series of steps that have to be followed. But in all of this, the most important message is that these tumors are curable. Even in the most advanced stages, these tumors are curable.